Hi, I'm Jack Allen, and I'm here today with Dr. David Asher, who I have known for a number of years and just think the world of. Uh, Probably 6 months ago or so, he introduced me to this product, and that was so unique to me because I've never seen you endorse anything before, David. And it got me very interested because I know you and I know how you think and how you act, and I've just never seen you be this enthusiastic about anything. So maybe start off by telling us a little bit about yourself,
Okay.
and then we'll talk about the product.
Okay, good, thanks. My name is Dr. David Asher. I'm an osteopathic physician. I've been in practice in Tulsa for about 35 years. My practice largely has to do with musculoskeletal pain management, and the need for some product that could reduce inflammatory pain and enable people to function at a higher level became very important to me because the medications and the over-the-counter non-prescription drugs that were available were not doing it for my patients. So in addition to the therapeutic benefit that I could provide through osteopathic manipulation, I needed an anti-inflammatory medication or substance that could provide additional benefit for these people to increase their function and decrease their pain. So this product has helped reduce their pain, overall increase their function, not only in the musculoskeletal system, but also in the other organ systems as well.
Dr. Asher, why would I take this product as opposed to maybe 10 or 15 other products that claim to make me younger and healthier and reduce my stress level and all those things? What makes Protandim unique?
Well, you're correct. Protandim is unique. It is a new category of a product that helps us be healthier. So how does this do it? The way it does it is what's unique. Exogenous or external antioxidants that you take by mouth attach themselves to free radicals on a one-to-one basis. So one free radical molecule, one vitamin C molecule, 11 pounds of blueberries, okay? How much does it take? You can take that much, but it's still a one-to-one. And when you take Protandim, you turn on your body's ability to make its own antioxidants. And we know that the antioxidant superoxide dismutase itself will scavenge, reduce, effectively annihilate 1,000,000 free radicals. So if you have
a million?
1,000,000 free radicals.
So 1-to-1 or 1 to 1,000,000.
That's right. That's the difference.
That's a little bit of a difference.
So why would you consider taking something external that's not unique to your body when you're a unique person and you have a unique physiology? If you can make something that is uniquely yours and it is 1,000,000 times more effective at reducing free radicals, that's the science. If it's 1,000,000 times more effective, there's no reason not to take it. You can't in any way create the same effect by taking external antioxidants. There's no formulation of taking this one and this one to create this.
Tell me about this product, Protandim. What is it and what does it do?
Protandim is a nutraceutical, which means it is nutrition in a pharmaceutical realm. Its primary focus is what we have called nutrigenomics. Nutrigenomics. It actually acts on the genome. So these are 5 herbs that come together to activate within every cell in the body an effect of increasing the antioxidant production in the body, so that every cell which is affected by pro-oxidation processes, that would be free radicals or other metabolic byproducts that do damage to the cell, Protandim raises the amount of antioxidant in the cell to counter the pro-oxidant effect. So we've called that oxidative stress, the difference between the amount of pro-oxidant or free radicals and the antioxidants which fight the free radicals. Because every cell produces free radicals, and because when they're in excess, because of largely because of the oxygen that we breathe, a percentage, some people say 0.5 to 2% of all the oxygen that we breathe in actually turns into reactive oxygen species, or these free radicals. Those produce damage to the cell, most often to the organelle within the cell that produce them. That would be the mitochondria. The mitochondria being the energy powerhouse in the cell, so that when free radicals are produced, the mitochondria are damaged, and we know that that directly relates to the aging process. In the last 10 years, there's been confirmatory research showing that the aging process as we know it, especially heightened in Western civilization by lifestyle, has been really a function of damage to the mitochondria by free radicals. So a substance, a product of herbs, not a drug, that can help the body fight a natural degradative or degenerative process is very helpful.
I've known you for several years. You have never, ever recommended a product. You recommend vitamins and foods and exercise and all that, but never have you recommended a product. Why Protandim? What's so special about that?
The first thing that attracted me about Protandim is the fact that it functions also as an anti-inflammatory. Protandim is 5 herbs: ashwagandha, bacopa, green tea leaf extract, milk thistle, and turmeric. And those are known across hundreds of, perhaps thousands of years to be safe promoters of health. But how did they work? What we discovered is that Protandim, as that combination in a very specific ratio, was able to raise in the cell the amount of antioxidants that the cell naturally makes. As we age, say up to age 20, we handle our oxidative stress pretty well, but after age 20, accumulation of byproducts, toxins in our environment, just the aging of the cell, it begins to be less effective in providing an antioxidant protection against the oxidation in the cell due to mitochondrial usage of oxygen and energy formation. As the body doesn't make as much antioxidant, the oxidative stress on the cell goes up, and over time cells become damaged. The result is, since disease is at a cellular level, when enough cells become diseased or sick, tissues become sick. And when tissues become sick, organs become sick. And when organs become sick, you're a sick person. So degenerative processes, we know that there are over 200 degenerative processes, disease processes that you know, that you recognize, that you may be concerned about in your own health. Those disease processes are mediated by oxidative stress. This difference between the available antioxidant and the amount of reactive oxygen species or free radicals that are being produced that do damage to the cell. So, because so many organ systems, talking about every cell in your body, therefore every tissue in your body and every organ in your body, is affected by oxidative stress over time, and the resultant increase in the aging process is much delayed by a product that decreases oxidative stress.
Okay. What exactly are free radicals, and how does this product affect those free radicals?
Free radicals are a natural process in the body. As I mentioned, mitochondria, where the energy powerhouses, where ATP or the energy molecules are made in every cell in your body, as a natural process of that motion within the mitochondria, free radicals are produced. It's much like the exhaust on a car. It's the leftover, it's an unbalanced particle that quickly attaches itself to some structure, in this case in the cell, the mitochondria, or surrounding portions of the cell, and the free radical attaches itself and does damage to it because it interferes with its healthy function. So antioxidants, whether they're produced inside the body, which is what Protandim greatly accelerates, or exogenous external antioxidants, are present to bind, capture, inactivate a free radical. So if we can raise the amount of antioxidants, we can reduce the overall damage to the cells. Now, the important part to be understood here about Protandim is not an antioxidant. Protandim is not an antioxidant. It is not going into the cell and capturing free radicals. The nice thing about Protandim is it enables you to make your own antioxidants. These are your personal antioxidants, in distinction from antioxidants that you take by mouth, which may be synthetic and in no real clear way consistent with your own physiology. So there's a fair amount of thought that too much or the wrong kind, especially imperfectly formed exogenous antioxidants, actually make you sicker. So there's a catch about taking antioxidants, but when your body is enabled to make its own, they're perfect for you. Protandim is one tablet you take once daily, best taken with food, absorbed well in water, but we recommend taking it with a fatty meal, something with a good fat in it. It absorbs well and starts this process rather quickly. People don't expect to feel something. It's like, can you feel your cholesterol going down? No, you can't. So it's not that you can feel your level of oxidation going down, but it is over time, when the antioxidant effect has been reduced, people do feel less pain, less stiffness, they feel better clarity in their brain. Their experience is that they feel better because the oxidative assault on our tissues is less as Protandim has increased its antioxidant effect. A word about oxidative stress. What you need to understand is that oxidative stress is like rusting. It's just a natural process. It's part of naturally what happens in our tissues. If ultraviolet light, for example, on the windshield wiper of your car or the rubber molding around the windows gets brittle and hard over time, that's a consequence of oxidative stress due to ultraviolet light. So ultraviolet light on our skin actually creates an effect of oxidative stress, and wrinkles are really no different than the process of sulfhydryl bonds binding together in rubber. So it is sulfur in our skin binds together and causes wrinkles. So we know that the oxidative stress process is present throughout our body, throughout nature. It's a natural process. So the effect of an antioxidant is to reduce that, and this product does it by making your own antioxidants. So you effectively rust less quickly. So the aging process is an oxidative process. All disease processes that are considered degenerative in nature are a consequence of oxidative stress. For 43 years, Dr. Joe McCord, who was the co-discoverer of superoxide dismutase, one of the antioxidant molecules, studied the best way for the body to be enabled to reduce oxidative stress. He picked from 56 different herbal products the 5 best, and of the 5 best, he chose the exact ratio which would optimize the effect of increasing the antioxidant production in the body. Now, how does this work? We have 5 different herbs optimally dosed. There's no way you can change the dose and improve on it. You can't take 1,000 milligrams of turmeric and do any better. In fact, that would be less effective because he's determined the optimum dose to optimize our antioxidant production.
So I can't just go to the health food store and buy all 5 of these products and mix them in a glass of water, or take all 5 of them orally in some fashion and accomplish the same thing?
That's certainly been tried, and without getting into the pharmaceutical attempts to mimic this very product, because of its wonderful anti-aging effect, there's been nothing else that's demonstrated a similar efficacy. And as you are aware, this is a patented product. There are 11 patents, and one of them is on composition. So the product will never be reproduced. It is, in fact, a one-of-a-kind product in this market. So what does Protandim do? Really, what does it do? When you take it by mouth, it's orally absorbed, it goes into your bloodstream, it circulates through all the cells of the body and goes into, it becomes a part of the extracellular fluids that affect cellular function.
There are a lot of people who would love to take this product, but don't want to have to become distributors of the product in order to purchase it. And many of these multi-level type marketing programs around basically are so focused on getting distributors that the actual product purchase becomes difficult for people who don't want to go through all that process. So how do I just buy the product that I believe in and want to use without worrying about whether I have to sign up as a distributor?
Well, you're correct. It is sold by distributors. It's not retail sales. It's not, you're not going to find it on any store shelves. So you have to have a relationship with an individual, and we like that relationship approach. If a person wants to use the product and not enter into a sales relationship, but just be a customer, it's very simple through the website of the distributor. The website has, it's very easy to click on Join Us on the website, and then it takes to a page where you can either choose to become a preferred customer or to be a distributor. And if you choose to be a preferred customer, it takes you to a product list, and you choose which products you want to buy, the number of quantity, and if you are a preferred customer, that gives you a better price. There is a retail sales available, but it's online. All of these sales are online, and they would be at there's actually an increment in the price for a person who chooses not to be on a monthly auto ship. So preferred customers, by being preferred, have chosen to be on auto ship, which means that they have one purchase per month, and it will come to them on a regular basis, and that is available through the website. If a person chooses not to be on a preferred customer monthly auto ship, but want to buy a different quantity, maybe buy 3 times as much and only buy it once or twice, and then not, or continuing just in hurdles, then they can also select a retail purchase. So it's available.
Okay. So anybody that's watching this particular video can, I guess we'll have at the end some information as to how you get into that website. And if you just want to purchase the product and or have little or no interest in being a distributor, you can still buy the product.
Yes, absolutely.
Okay. Well, I think that's important to a lot of people.
We want everybody to take this. 100% of all mammals tested in Dr. McCord's studies in these several years of testing Protandim, 100% of mammals, humans included, had reduction in oxidative stress. So we think everybody should take this.
That's pretty real.
Yeah, everybody should take this if you want to improve your health. So if you choose to be a distributor, if you choose to be a preferred customer, please take the product.
Okay. Thank you very much. I appreciate that. That's good information.